Greetings. My name is Katie Eichley, and I'm the director of the Aurora Center for Advocacy and Education at the University of Minnesota Twin Cities. For nearly 30 years, the Aurora Center has provided services and education around issues of sexual assault, relationship violence, and stalking. Today, we're here to learn about how to love. More specifically, we're going to learn about overcoming obstacles that may arise when people come to us in crisis and need our help. This crisis intervention model that we're going to learn about is called a love plan. And in a love plan, the skills are transferable and also helpful in disclosures of sexual assault and relationship violence, but can also be used when people disclose difficult things to us, such as the loss of their loved one, or they've received difficult medical news, or even that they've lost their job or lost out on an amazing opportunity. In many situations, when someone is coming to us for help and support, a crisis intervention approach may be useful. Now, before we begin, it's important to acknowledge that before you engage in any activity where you're caring for others, you really need to be aware of your own self-care. Self-care is important because it's kind of like a balloon. When you fill a balloon and let out the air, that air release is like you giving to your work, giving to your friends, giving to your academics. And once the balloon is empty, you have nothing else to give. So that's why it's important to engage in activities that really fill your cup or fill your balloon. The more air that you put into your balloon, the more air you can release, and for longer periods of time, until with practice, you actually build elasticity within yourself. So if you notice, looking at the presentation, there's a playfulness to it. My own self-care is playing video games with my two sons. It's a way for me to decompress, rejuvenate, re-energize, because if I don't, I'll empty out my balloon and I'll experience something called compassion fatigue. And so step number one is, in crisis and intervention, you want to care for yourself before you care for others. Now, I like to have an engaged audience, and so if you are watching this with a group of friends or a class, or maybe you are by yourself learning more tips about self-care and how to love, there's an activity I want you to try. If you're in with others, I want you to partner up, no more than 2 or 3 people in a little group. And I want you to assign a listener and a talker. If you're by yourself, assume that you're the talker and say someone that you work with or that you have class with is sitting next to you. Now, talkers, here's what I'd like you to do. Using great eye contact and superlative detail, I want you to tell your listener about your best sexual experience. Go. All right, stop. For many of you, if you're watching this, you probably felt a sense of heightenedness and awareness. I usually ask audiences, how did they feel? And the typical responses are, I was embarrassed, I was shocked, I was in disbelief, I didn't want to do it, right? That is very normal. But what I also ask is, well, why did you feel that way? And most commonly I hear that this is a professional setting, that kind of information is private, I don't have language to talk about it, and generally, we don't talk about sex. And in Western culture, that's actually a norm, that very few of us are taught and encouraged to talk about sex in an educational way. And so, going in and knowing that, imagine I asked you to talk about your best sexual experience. What if I asked you to talk about your worst? And not only talk about your worst sexual experience with someone that you care for and trust, but to talk about it with someone who's a complete stranger. To talk about it with someone who may be judging you, maybe trying to find ways or using language that feels like it's blaming you for something that you had no control over. And so when 1 in 5 women experience rape and attempted rape while in college, 1 in 31 men experience sexual assault in their lifetime, and 50% of transgender individuals experience sexual assault in their lifetime, it's safe to say for me that all of us actually know someone who's been sexually assaulted or impacted by gender violence. And therefore, if you have never received a disclosure, there's a high probability that someday you may. So today's goals on learning how to love is basically building your comfort around how to broach those uncomfortable topics. And specifically, that comes in 3 objectives. 1, to be honest and address the anxieties that you have in receiving a disclosure. 2, to learn and practice and to provide you a crisis intervention model that you can follow. And last, of course, is to practice that crisis intervention model. Now, in order to do this, there is a common fear which I like to call phobophobias, or fear of fears. And if you're in a large group, you can take a pause for a moment and talk about what fears do you have if you left this room and that moment someone came up to you and said and disclosed, I've experienced a sexual assault and it was this past week. I want you to think about, in that moment, if someone just delivers that information to you, what would you do? What would you say? Most commonly, the fears that people tell me about is that they're afraid of saying the wrong things, or simply not knowing what to say, or even what are my legal obligations in that type of situation. Those are all things that we're going to cover. Specifically, what are the things I shouldn't say? Typically, those fall under victim-blaming comments, things that may provide judgment. Victim-blaming comments can be as simple as, well, what were you wearing? Why were you there at that time? Why weren't you walking with? The why questions are actually very re-traumatizing. And so I would recommend avoiding those kinds of questions when someone is trying to be vulnerable with us and share a personal experience. Secondly, in testing the waters, not everyone comes out directly and says, this was my experience and how horrible it was. Typically, especially with something as delicate as sexual assault and relationship violence, they will tip their toe in very gently and see if you are a trustworthy person. When I'm working with faculty members, oftentimes they tell me, my student has told me in a paper that they wrote that they had this experience a while ago, and I don't know what to say or what to respond or how to respond. But that's a great example of how people may be testing the water to see if you're a trustworthy person, that they can provide this fragile bit of information, and that person receiving that information won't just drop it on the ground and smash it to bits. And so some of the ways that you can actually create an environment in which people might feel comfortable coming to you around vulnerable issues would be to simply say, I'm a non-judgmental person, and if you need help, I'm willing to listen. Now, we don't always get the opportunity to say it as bluntly as that. It's more subtle in how you might talk about certain issues such as gender roles. People will pay attention to the comments and the opinions that you might have, and then want to connect with you because they feel like you're a trustworthy person. And so be mindful that we may not know when a disclosure comes, but that when it does come, it's a gift. To give you a real-life example, when I was starting off just as a new advocate, I had very little experience, and one client came in and said, I need someone to talk to. So we went to our office and we sat down, and she was so emotionally distressed that really all she did for the 30 minutes that we were together was release emotion and cry. And I would ask her questions like, would she like to talk about what happened? Would she like to, tell me more? Or does she need anything? Does she feel safe? And for her, she just needed a safe space to let it all out. After 30 minutes, she had to go up and go to class, and she left. I collected very little information, and as my first time as an advocate, I felt like a failure. I felt like I didn't know or didn't contribute to her healing at all. Lo and behold, about a week later, she came back, and she requested to meet with me specifically. And it was that time that she actually talked about what happened to her, what her experience was, and some of the help that she actually needed. But she was specific in telling me that had I not given her that space that first time to just let it all out, she may not have come back. About a month later, even after that incident, she returned, and she was angry at that point. She wanted to file a report, and she had time to process through her experience and realize what the better choices were for her. And so that's an example of how sometimes we have to have patience to allow our are the people who come to us to have that space to test the waters. Now, a big question I get from faculty, staff, and even student leaders is, when do I have to actually report? What are my confidentiality rights? And the thing to know about students, faculty, and staff is that you may not be a confidential advisor. In fact, sexual assault counselors are usually the only people, maybe folks with a medical or mental health background or certification, are the only folks who may be deemed confidential advisors. Given that information, the University of Minnesota does have policies regarding what mandated reporting obligations our community has. And what the language says is that if the assault was against a child, you must immediately report the abuse to your university or local police, county sheriff, or some type of local community social service agency. And so in addition to that, we are all mandated reporters when it comes to the abuse and neglect of children. Again, another point under university policy then is who is a responsible employee, that when a student comes forward and discloses sexual assault, that information actually has to be reported to the campus Title IX coordinator. On our campus, that Title IX coordinator is Kim Hewitt, and that is she's housed in the Office for Equal Opportunity and Affirmative Action. The language around responsible employees then says that if you are a university employee with supervisory or advising responsibilities, such as an advisor for a student organization, you must contact the Equal Opportunity and Affirmative Action Office to inform them that the report you received a report of sexual assault, and then they will guide you on next steps. All other non-supervisory employees then should talk to their supervisor for guidance on next steps. You may also want to contact your campus program for against sexual assault to receive further guidance. And so at the Aurora Center, we definitely do a lot of consultation on what responsibilities faculty and staff have in supporting students. So then that brings us to our second hurdle, or our second obstacle, which is actually broaching the topic. And so this is a point where I'm going to pose a scenario, and I want you to maybe pause or think about what you would actually do. Maybe go back to that partnership that you talked with earlier. And here's your situation. Once again, we're leaving this training, and perhaps you forgot everything that I had said. And you do get a disclosure immediately after about a sexual assault. Given the information that you know right now, I want you to brainstorm what you would actually do or what you would actually say. The reason I actually had you think about that is because we can all create plans and devise a plan of action for when we're actually in that situation. And if we recognize we don't have all the information we need, we can readily try to seek that information prior to an incident actually occurring. Moving on then. A love plan model. So this is a model composed of 3 separate models regarding crisis intervention. The first model comes from a medical model on how medical staff respond to patients who may have disclosed sexual assault or relationship violence. The second piece of the model, actually comes from a counseling model. And the last is from the emergency preparedness efforts of when natural disasters and crises occur within the community, that not only are there tendencies to take care of the physical needs, but also the behavioral health needs. And so a love plan focuses on an acronym. A love plan focuses on an acronym that's ALUVPLAN. When I proposed this to my family members, they looked at me and said, it's really hokey. And I was really excited that they said that, because that is the point. I want something that you will remember later on. And if you forget what the acronyms actually stand for, what you need to do is actually laid out in the name. Give them some love and figure out a plan. But let's look at a love plan more closely. How do I respond to disclosures? And the first thing is A, ask, or simply acknowledge that something might have been said that lingers on, that a person may have had a traumatic experience. And so ways that you can ask is to simply seek permission. I noticed that you mentioned this before. Can I ask you more about it? If you're a person who is actually from the opposite gender and you're concerned about gender roles and dynamics, you can ask that person, are you comfortable talking to me about that issue? At the Aurora Center, we have advocates of all genders. And so when we encounter that on our helpline, or when people walk into our office and encounter someone of the opposite gender for themselves, we make sure to ask, are you comfortable talking with me, or can we get someone else to talk to you about these issues? Second is listen. Now, the important thing about listening is that listen and silent have the same exact words. A few years ago, my partner actually told me, and we've been together for many years, that, Katie, you are a horrible listener. And I was offended and shocked, and I'm like, what? Are you kidding me? I get paid to listen. I'm a professional listener. I am a professional here. And I realized at that moment exactly what I was doing. And so when I talked to my partner about his day, I'm very intentional about, okay, Katie, you need to create silent space so that he can actually share. LUV then is understand. U is for understand. To understand what the person is saying, to be present and to believe what the person is saying, and that what they're saying is powerful and impactful for them. What are they feeling? What are they wanting? But really to be non-judgmental. And that's a hard place. You may have thoughts of what you would do differently, but in that moment, that person may not be needing that judgment. V is simply validate, reflect what you just heard and what was just said, to rephrase what they've been through. So if they talk about how all these different things happened and nothing went right, a simple way to rephrase that is, it sounds like you had a really tough day. And what do you need now? I also like to say validate feelings or emotions, to validate facts, and to validate values. That way it truly demonstrates to the person talking to you that you have been paying attention. The last part of a love plan is then the actual planning piece. P stands for promote safety. If anything else fails, if everything else fails and you can't remember what to do, safety is always a great place to start. Do you feel safe walking to class? Do you feel safe going to work? Do you feel safe going home? Those are ways in which you can connect with someone to make sure that they're going to be okay. And safety does look different for each person. So it's helpful to ask them, well, what would make you safe? Or what would make you feel safe? What one person feels is as a safety technique is not necessarily what others might feel as a safety technique. L in the plan. Again, listen, calm, and comfort. Especially when it comes to sexual assault disclosures and relationship violence disclosures, believing someone and letting them know that you believe them, and especially saying it's not your fault. It might seem like a canned phrase, but when you're in that moment of trauma, it's one of the most powerful phrases that someone can ever say. And so I make sure to say that normally we provide options and we don't provide judgment, but that is one thing I'm a stickler on, is making sure a person knows that is not their fault. They may still blame themselves, and that's a normal common reaction. Blame is oftentimes a manifestation of shame. Shame that something happened to them. Shame that they had no control. And when you blame, and when we blame as a community, that is actually us trying to provide control over a very shameful situation. And so a lot of times I will see victim survivors blaming themselves. And what I will share with them is I can understand why you might blame yourself. It's still not your fault. Because again, blame is a form of trying to regain control of an uncontrollable situation. A, arrange connection. So sometimes we don't feel equipped to deal with everything that's going on. And so it's important to know what services are available, such as the Aurora Center, potentially the Counseling Center or the Health Center, of course law enforcement or the reporting offices on a university campus. Those are all various services and referrals that we can make. But additionally, a victim survivor or any individual going through trauma is going to need social support. So making sure that if you're a friend, that the individual that you're working with also has other friends or other family members that they can connect with. The last one in a love plan is nurture empowerment. So we do need a sense of hope. And even though it's a tough road ahead for people dealing with trauma or any kind of crisis, we can always say this is going to be tough, but you're not going through it alone. And I'm here with you, and there are people who care about you, and I believe that you can get through this. And you'll have your moments of ups and downs, and that's okay. That's why we have support networks. So with the love plan as a demonstrated model, it doesn't mean that you have to have all the right answers. It simply means that you have a plan to help your friend in need. I recognize that operating the love plan is a lot of passive work, where you're listening, you're affirming, and some of us are doers. I, for myself, am a doer, and so I like to think about the action plan. And so more specifically, if you're concerned about, well, what can I do to help this person? There's a checklist that I want to go through with you. The first thing, though, is connecting them to some type of counseling or therapy. Now, some people are resistant to that, and that's understandable, but to simply say, there is counseling available, there's someone who can provide perspective on what you're experiencing, and that can be obtained through the University Counseling and Consulting Services, through Boynton Mental Health, through actually the Sexual Violence Center, which is a local community sexual assault crisis center. Additionally, of course, there's always the Aurora Center at the University of Minnesota Twin Cities. Secondly, medical attention. If a sexual assault has happened within the past 120 hours or 5 days, they still have the opportunity to attend any emergency department and receive a forensic medical sexual assault exam, where trained specialized nurses will actually collect evidence and swabs, and you do not have to file a police report at that time. Third, some folks have concerns about their housing then, whether it's on campus or off campus, housing and residential life, or university student legal services, or any landlord can provide some options in terms of what is available to ensure safety. If landlords off campus provide some challenges or may not know completely all the laws, a place like the Aurora Center can help to point out that when you've experienced sexual assault or domestic violence in a relationship, there are laws in the state of Minnesota that actually help you to get released from that contract. Fourth, you may have concerns around your academics or your work. And so certainly, again, the Aurora Center will provide academic advocacy or employee advocacy to contact the people that are appropriate and request accommodations. You can also contact the campus human resources or go straight directly to your supervisor to work out arrangements in terms of what is it that you need to help in a recovery process. Fifth would be contacting the police or the university for a report. On our campus, the University of Minnesota Police Department and the Equal Opportunity Affirmative Action Office are both places where you can file reports. If you file a report with law enforcement, that of course will be a criminal investigation. And at this point, the University of Minnesota Police Department does not accept anonymous police reports. And so at this time, if you want to file a police report, we want you to know that they will be working forward to conduct an investigation. One of the last two options that you have is looking at your legal options. And so you will definitely have criminal justice options, you will have university options, but then you could potentially look at a civil suit. That would mean obtaining an attorney to look at your case and see if you want to charge civil charges towards an individual. Other types of legal issues that may come up may include a restraining order or an order for protection, something that will protect the victim survivor from having contact with their accused individual. And the Aurora Center does provide advocacy to actually sit down and write restraining orders with victim survivors and actually file them within Hennepin County and Ramsey County. And of course, the last piece is, financial needs. So if you're a student within the University of Minnesota and you actually need to withdraw from some classes due to safety or some mental health issues, maybe you're withdrawing from the campus for the semester, we can assist you with that financial assistance through working through One Step. So far, we've talked a lot about how to be present with someone when they are initially struggling through that disclosure. We talked specifically about a love plan and how to ask and listen and understand and validate, and then move to the plan piece. It's really important to do the ALUV piece before you jump into the plan piece, because sometimes people just want you to listen to them and they're not ready yet to move on to actually doing something about it. But in order to help you actually put this into context and practice it in real life, I have 4 scenarios that I want to cover with you. Scenario number 1 is around academic withdrawal. And what we have is a situation where 2 weeks before the fall semester ends, your best friend tells you that they are thinking about withdrawing from 4 out of the 5 classes. And your friend has been acting a little bit more withdrawn and anxious lately. And so a comment that your friend says is that, "I've barely gotten through this semester. I didn't think it'd be so tough, and it seems like nothing's gone right since homecoming." Utilizing a love plan. What might be your response to this kind of comment? If you've had an opportunity to really think about that, I do have some samples of responses that you could possibly utilize. The first response is, "It's been a tough semester for all of us, and tell me more about what's been going on." The second is, "It sounds like you're going through a lot. Are you okay talking to me about what happened?" And the third is, "I have a handout that might help you and someone I think you could contact to talk to." Of those 3 options, which do you think is the best response? A, B, or C? Now, typically my audience will identify that this B is the appropriate response based on a love plan, that it sounds like you're going through a lot, so it validates what a person is going through. And are you okay talking to me about what happened? Again, you're asking a little bit further about their comfort level. Second scenario, a classmate you know brings up a concern after class. "My roommate has a really intense girlfriend, and she's freaking me out. She came over last night yelling at my roommate, screaming and trashing her stuff, and I don't know how to deal with them anymore." Again, utilizing a love plan, what might be an appropriate response for this type of situation? Some options include, "I'm sorry you had to go through that. I'm sure with time this will all blow over." Second, "Wow, tell your roommate to dump her." And third, "Do you and your roommate feel threatened or in danger by this person? What do you want to see happen?" Now, based on those 3 types of responses, the third response is actually the most appropriate, utilizing a love plan. Again, it's acknowledging the fact that a person might be in danger, and so it's going to the safety piece, but it also puts power back into control for that person. Oftentimes with sexual violence and relationship violence, power is being taken away from those victims or the people directly impacted. And any opportunity that you can actually give to give power back is really vital. And sometimes a victim survivor and their support people may choose not to do anything. The important thing is it's a choice that they get to make. And it may not be the choice that you and I make, but that's what's really important in the healing process. The third scenario talks about a fellow employee that you work with who discloses that an ex texts them about 50 times a day, and it's getting annoying. After going and offering that colleague some space to talk, you find out that they do feel safe for now, and so you continue to discuss the project that the two of you are working on when you notice that another text comes in. The response that your colleague might say is, I'm sorry, what did you say? It's really hard to concentrate. Again, some responses could include, that's all right. Your reaction is understandable, kind of given what you're going through. And honestly, if you want to explore some of the options, I know that the Aurora Center may be able to help. Secondly, you need to pay attention to what we're doing here to get this done. And third, if you change your phone number, that would stop this person from contacting you. Again, in all of these responses, none of them are necessarily horrible responses, but utilizing a love plan, which we're trying to provide support and connection, the first response of that's all right, it's an understandable reaction, is most affirming. And our last scenario, your roommate is upset with a class conversation they had about sexual assault and gender roles. And after asking her to tell you more, you suspect that she may have experienced sexual abuse, and so you ask her if she's been hurt in the past. Her response is, it happened a long time ago and I'm fine now. I just think that the professor should have handled the discussion better. A way that you can respond or reply? Response number 1, you're right. That professor was totally out of line and mishandled that. Response number 2, you probably had a triggering moment, which is why the class discussion upset you. And number 3, thanks for trusting me with your story. I'm willing to listen if you want to talk about it. If you wanted to give the professor advice on or some resources on how to address issues like this, the Aurora Center could help with that. Again, you can choose any one of these. Utilizing a love plan, the third response may be the most appropriate, and validating what your friend has gone through, but also providing some resources and information. With that, I want to emphasize that you don't want to jump to the resources and the planning first. That sometimes you have to just be present with the person, to be compassionate and not necessarily feel like you have to fix it. And this video that you're about to watch by Brene Brown on empathy really illustrates that you need to be present with people and take their perspective and make it your own. And that's actually a very difficult thing to do.
So what is empathy, and why is it very different than sympathy? Empathy fuels connection. Sympathy drives disconnection. Empathy, it's very interesting. Teresa Wiseman is a nursing scholar who studied professions, very diverse professions where empathy is relevant, and came up with 4 qualities of empathy. Perspective taking, the ability to take the perspective of another person or recognize their perspective as their truth. Staying out of judgment, not easy when you enjoy it as much as most of us do. Recognizing emotion in other people and then communicating that. Empathy is feeling with people. And to me, I always think of empathy as this kind of sacred space when someone's kind of in a deep hole and they shout out from the bottom and they say, I'm stuck, it's dark, I'm overwhelmed. And then we look and we say, hey, you climb down. I know what it's like down here, and you're not alone. Sympathy is, ooh, it's bad, no, you want a sandwich? Empathy is a choice, and it's a vulnerable choice, because in order to connect with you, I have to connect with something in myself that knows that feeling. Rarely, if ever, does an empathic response begin with at least. And we do it all the time. Because you know what? Someone just shared something with us that's incredibly painful, and we're trying to silver lining it. I don't think that's a verb, but I'm using it as one. We're trying to put the silver lining around it. So, I had a miscarriage. Oh, at least you know you can get pregnant. I think my marriage is falling apart. At least you have a marriage. John's getting kicked out of school. At least Sarah is an A student. But one of the things we do sometimes in the face of very difficult conversations is we try to make things better. If I share something with you that's very difficult, I'd rather you say, I don't even know what to say right now, I'm just so glad you told me. Because the truth is, rarely can a response make something better. What makes something better is connection.
So the last thing I want you to know in providing crisis intervention for individuals, particularly around sexual assault and relationship violence, is that here at the University of Minnesota, there's an expectation that whenever a victim survivor comes forward, whether it's to another student, a faculty member, or a staff member, that they receive a paper copy of the University of Minnesota's Victim Bill of Rights. And that is actually available at z.umn.edu/Aurora. And you can see it here on the screen. It means that you do not have to be completely knowledgeable about what everyone's rights are, legal obligations, what kinds of resources there are. All of that information is compiled on one single handout that can be provided to someone. And quite honestly, when a victim survivor or someone in crisis is sharing a personal story, the last thing they really will be able to remember are all the phone numbers, websites, and resources available. What they will remember is that you sat with them in that moment, maybe in a moment of pain and vulnerability, and you didn't walk away. You affirmed what they felt, you believed them, and most importantly, you told them it's not their fault and they're not alone. Thank you so much.